Welcome to the Indian Girl Stateside episode of Indian Americans and Their Health. Today is the 8th day of August 2017. Namaste, Namaskar, Sat Sri Akal. Welcome to this episode. In fact, it's the first episode of the Indian Girl Stateside. In today's show, we will be talking about the healthcare and the Asian Indian community. If you look at the Asian Indian population, there has been an increase, or there was an increase in the immigration of Indian Americans between 1980 and 1990, and that increase was at 125%, and that's huge. That's a pretty significant number. If you look at the overall healthcare, if you look at the community in general, the Indian Americans are mired with obesity-related diseases such as diabetes, which is one, it has impacted my own family. The second one is things like coronary heart disease. So the other things that come up over here in this list that I actually found online was hypertension, cancer, nutritional deficits, tuberculosis. Then there are a few, but amongst the major ones, if you look at the list here that I'm looking at, it's cardiovascular disease, hypertension, diabetes. You would think that we eat a pretty healthy diet. For folks back home in India, that's probably the case where your staple diet is rotis, grains, vegetables, and things that basically are staple to the community. As soon as Indian Americans come to the U.S., people do try to stick to the diets, but once again, not sure if it's because of the cultural shift where folks come to the U.S. and they become more Americanized, where they're eating fast food. I know I've read and watched a couple of documentaries where you have the Japanese, and there were studies done by folks on the Japanese community, and when they came to the U.S., how the second, third, and fourth generation Japanese actually didn't follow the strict Japanese diet, but they would come to the U.S. and they would actually get assimilated and eat, follow the American diet, fast food, so on and so forth. Not that I'm saying an American diet is bad. I'm saying the American diet, which typically has been projected around the world, includes, fast food, hamburgers, fries, so on and so forth. Now, it's interesting if you look at statistics. In India, only 1 in 40 women gets breast cancer. Now, flip the coin. In the United States, 1 out of every 8 Asian Indian women will get the disease, which is the highest incidence in the world. According to the American Cancer Society, South Asian women have the second highest incidence of cancer amongst Asian Pacific Islanders. If you look at the demographics between what diseases impact the Indian American Asian men versus what impacts the Indian American Asian women, Indian American men in the U.S. have a high prevalence of heart disease, high cholesterol, hypertension. But if you contrast that with Indian American women, they are at a high risk of osteoporosis, and diabetes obviously is prevalent in both males and females. Many Asian Indians are basically, from what I've read online and from the research studies that have been published out there, they're not aware of basic nutritional factors. The typical Asian Indian diet averages 56% of energy intake from carbs, 32% from total fat, and 8% from saturated fat. The high fat intake is associated with obesity and low leisure time activity. I know amongst the Indian women in general, they would tend to put their families first and don't take care of their health. Well, I have a view that is contrary to other Indian women in that I think it's important to take care of yourself first. When I say take care of yourself first, I don't mean go out shopping on your own and ignoring your kids. I'm saying spend some good quality time, an hour every day, doing physical activity like yoga or just walks in general. Because I guarantee it, if you are happy, your family is happy, and everything else is smooth. Um, from a men standpoint, it could very well be there's a cultural issue there. Men are typically the breadwinners of the family, and there's stress related to that. I can only imagine being in a household where you have one breadwinner. Granted that in modern days and times, I'm not saying that it's frowned upon to stay at home, but essentially sharing the burden, I think, is something that's valuable in order to release stress from one partner as far as being the sole breadwinner. The other factor, if I look at the reasons as to why there's these diseases and it's prevalent, is if you look at India in general, the culture and the religious celebrations and celebrations in general, not religion per se. There's a lot of celebrations. I mean, if you look at the Diwali, the Festival of Lights, which you typically have in October and November of each year, folks tend to splurge. Sweets, you have all the 9 yards of the delicious, in fact, irresistible sweets that you have out there. Once again, as you grow older, you probably should watch what you're eating. There's other factors as well. I mean, Asian Indian women, if you look at just women in general, they don't believe, they haven't been involved in active sports or active exercises. They're more involved in passive sort of exercises. And what I mean by that is when you say passive, it's things like non-aerobic exercises, maybe just saying, hey, I've done so much work during the day, meaning cooking and cleaning, so on and so forth. Therefore, I wouldn't want to go out and do aerobic exercises. I'm done with my exercise for the day. That's actually a misconception. Working at home, great, but that doesn't really exercise the muscles, doesn't exercise the heart. I think it's important for women to go out there and exercise, as I said earlier, at least half an hour. Start with about 15 minutes a day. Increase it to half an hour. Do as much as you can during the day. Don't be too rigid. The other things that we can look at is, in order to keep a controlled diet, think about replacing the following in your diet. I know the Indians tend to have rice quite a bit, depending upon which part of the country you are. Say, for instance, if you're from Bengal, you'll tend to eat more rice and fish, and your diet is more rice-based, even in South India. But however, if you replace white rice with, say, something like brown rice, and then do some portion control, replacing white potato with maybe sweet potato. There's abundance of sweet potato out there. Avoiding fried foods, avoiding things like too much salt, avoiding butter, fats. I think the recommendation, if I was reading online, was to choose tandoori style foods, which I believe are a lot more healthier because they have less oil in them. So if you go to the Indian restaurants, you'll see the chicken out there with tandoori, which definitely looks delicious and is could be a healthy option as well. A lot of Indians actually use canola oil. Replace the canola oil with healthier oils like olive oil, and also with things like coconut oil as well. There's this big hoopla about coconut oil, though it is controversial. We won't get into that today. But replacing basic canola oil, vegetable oil with healthier oils such as olive oil and other healthy oils that are out there. The other recommendation was to switch to low-fat yogurt. I'm not too sure about that one. Low-fat yogurt could end up being a lot more sugar, or they do add replacements in the yogurts from what I've heard and read. So I wouldn't say that. Just in moderation. Eat whole yogurt, whole milk yogurt, but in moderation. The other thing that we have in our diets is cinnamon. Cinnamon reduces blood sugar. So having cinnamon in maybe your tea, cinnamon in general, adding it to your diet could help in reducing blood sugar. So uh, the end result of this is, I think, watching your diet, watching your intake, the amount of foods you take in is definitely helpful. If you're not getting the exercise in proportion to what you're eating, remember, it's all about calories in, calories out. So it's what you take in. Can you expend that? That's the real question. So here you go. I mean, healthcare is and health is so critical because without health, you basically have nothing. And for the Indian American Asian community, it's pretty significant for folks to kind of pull it together and get healthy. Once again, thank you so much for listening to the Indian Girl Stateside, and I look forward to hearing from you and hearing about your comments and see what you'd like to hear. Thank you.